Concern about the NHS's unwillingness to spend money on expensive cancer drugs is a long-running theme. That's why David Cameron announced the Cancer Drugs Fund back in 2010, an England-only £200 million a year specialist pot to pay for drugs that otherwise would be refused for costing too much.
Just ask Clive Stone. I met him years ago when we were in opposition. He had cancer, and he said to me, "The drug I need, it's out there, but they won't give it to me because it's too expensive. Please, if you get in, do something about it." And we have. A new cancer drug fund that has got the latest drugs to more than 21,000 people and counting.
Newsnight has learned, though, that the Cancer Drugs Fund is now running over budget, and officials are expected to announce tomorrow that it will be increased in size from £200 million a year to £280 million a year, starting from this year. The fund will also be subjected to a new cost-benefit regime. That will mean that the least effective drugs cease to be funded, and the most expensive drugs will have to prove their worth if they're to continue to be funded. Some pharmaceutical companies should expect that they will be told that their drugs are now too expensive for the drugs fund that was set up just to pay for the most expensive drugs. This issue all revolves around NICE, the body which decides whether treatments are cost-effective enough to be bought by the NHS. It says that drugs should cost no more than £20,000 to £30,000 for each extra so-called Quality Adjusted Life Year, or QALY. That basically means a year of life in good health. Now, the amount they'll pay for a QALY is sometimes higher, like they pay more when they're dealing with end-of-life drugs. But even so, cancer drugs often just cost way too much.
NICE struggles in cancer, and that's publicly acknowledged, hence the Cancer Drugs Fund. The issue there really is the advent of the new science means that we have highly targeted medicines against smaller patient populations, but fixed R&D costs. So a new drug costs well over £1 billion against a very small patient population, a targeted medicine. And therefore what that means is you have higher headline prices per patient. That's fundamentally what's happened over the course of recent years.
And this is almost £3 worth of tablets, so it's unbelievable cost.
That's why there's demand for the Cancer Drugs Fund. And some of these medicines really do make big differences.
In 2008, I was diagnosed with advanced prostate cancer. I was put onto the hormone therapy treatments, which are usual in that situation. And then I carried on through until my levels changed, and I was then advised by my consultant to go on to something called abiraterone acetate. It's a new drug at the time. And this carried on and has allowed me to continue my professional life and my family life to the full, and has allowed me again to avoid chemotherapy and any of its effects. This was all only possible because of the Cancer Drugs Fund.
But if the Cancer Drugs Fund lacks rules on cost effectiveness, drug companies can just charge very high prices. And when you discuss that problem, one company comes up a lot. Roche, the Swiss pharma giant, accounts for 1/4 of Cancer Drugs Fund spending. For example, it produces Kadcyla, the latest high-cost cancer treatment to be rejected by NICE. Now, Kadcyla costs £90,000 a throw for an average of a little under 6 months of extra life. That gives you a cost per QALY of £166,000. That's several times more than the most generous of NICE limits. Now, officials really don't want to delist effective drugs, nor do they want to undermine what's a flagship policy for NHS England. But if they don't have the power to say to drug companies, "We won't buy at that price," they don't have any negotiating position at all. And with rising numbers of cancer patients, the inability to keep the cost of cancer drugs down is a major concern. This is a tough issue. Roche say that NICE's methods just aren't fit for purpose. Other pharma companies point out that the prices we are willing to pay per QALY haven't actually moved with inflation. And many people ask whether we should be exempting cancer patients from the NHS's cost control systems at all.